Good evening, everyone, and welcome. I'm Tanya Winders, the President and CEO of Allergy and Asthma Network, and it's my pleasure to be with you all this evening for our 6th in our virtual conference series titled Black People Like Me. This evening, we'll be talking about patient advocacy in asthma and COVID-19, and where do we go from here? And we'll also be taking your questions. So at any time, feel free to go ahead and put those into the chat box or into the Q&A control panel. We'll get to as many as we can throughout the course of the program. Again, this is a PCORI, Patient-Centered Outcomes Research Institute funded project that Allergy and Asthma Network has hosted over the last 6 months. And this evening, I'm joined by our medical director and co-host, Dr. Leroy Graham, who is also here on camera. Dr. Graham, wave to everyone, say hello.
Hello.
Great.
Thank you for joining us.
Absolutely. So with this, again, we've got a full agenda. We'll be about an hour and 10 to 15 minutes this evening, and we want to hear from you. So weigh in. Certainly don't hesitate to provide your thoughts as you hear from a variety of experts and patients in our virtual conference this evening. So here's a little bit about what we're going to cover in our time together tonight. So first, you're going to hear an overview from Dr. Graham and myself around our Not One More Life Trusted Messengers program. And this is a program that actually partners with faith-based organizations to deliver COVID testing and COVID vaccination, as well as respiratory screening and general health screening and education. And then you're also going to hear from Lola Williams, who is a young person that from our community that has actually moved forward in getting her COVID vaccine. We're going to hear about why she made that decision and how she's helping to share and spread the word. Then we're also going to hear from Mary White. For those of you who have been with us over the course of the last 6 months, Mary is no stranger. She is an amazing patient advocate and has certainly helped to advance this program within the community. Next up, we'll have words from Dr. Gupta as well as Lola Williams, and they will share with us about asthma and COVID-19 in the Black community from Combat COVID-19, the organization. And again, I am very excited about this presentation. When I learned all the things they are doing and the synergies of all the work that we have been exposed to over the last 15 months, it's just so inspiring to see all the work that's ongoing. And then we'll wrap up our time with hearing directly from a patient, Reverend Dr. Michael Stinson, who again is a great friend to Allergy and Asthma Network, but who has walked this journey as a COVID-19 patient, who has survived COVID-19 and is here to share a bit more about his experience. And then, as I said, we'll take your questions and answers, so don't hesitate to go ahead and put those in throughout the course of the evening today. Again, we'll talk about some of the myths and the facts about COVID-19, some of the community programs, the need for diversity in research, and also for COVID-19 treatments, but also about advocating for yourself, for your community, and how to stay involved. Because you guys know, we've been here for 6 months on a monthly basis, talking about how important it is to be involved, to be activated, to be educated. And so we're going to leave you with some next action steps of ways that we can depart from one another this evening and jump in and stay involved within our community to continue to educate, engage, and empower people to better health outcomes. We do have about 1,500.
Tanya, if I could break in, we're not seeing your screen. If you could show your screen.
I am sharing my screen, so that's odd.
I'm seeing you, Tanya.
You're seeing my screen?
I'm not seeing your screen. I'm seeing you. I don't see your screen yet.
Okay. It's saying that I'm sharing my screen, and I see it here on my screen. So that's, let me do one quick thing. How about now?
Yeah.
Can you see the slides now?
Yes.
Yes.
Okay, sorry about
Yes.
that, guys. There was a little bit of an issue with the program earlier, so I'm glad that you stopped me, Linda. Thank you so much. So again, this is our agenda. This is what we'll cover, and please don't hesitate to put your questions in throughout the course of the evening. Now, one thing to remember is that we do have about 1,500 people registered and on the line tonight. So your lines will be muted, and we will ask that you will continue to try to keep yourself muted if you are not actively speaking, as well as any video. If you happen to have your video, please keep that off to avoid any distraction. All right, so let's get started. So as I said, we do have an illustrious group of speakers tonight. If you have watched the news, if you have seen the word about COVID-19, then this face will not be unfamiliar to you. Dr. Vin Gupta is a pulmonologist and public health physician, professor, and health policy expert with Combat COVID. And he, alongside Ms. Lola Williams, MBA, the program director from Combat COVID, are going to share a great deal about their project tonight and the difference that they're making in the community. And then, as I said, we're going to hear from one of our teens, Sailor McKenzie Williams, as well as our patient advisor, Mary White, and our COVID patient, Reverend Dr. Michael Stinson. So as we get started, let's, actually, I don't see the music file here, Mary. Don't see a link to the music file. So what I'll do is I'll just remind you that we do have COVID music. We have songs that are educational, but also reinforce solid messages. These are jazzy blues type of songs that were created by a respiratory therapist, Al Keith, who's also a certified asthma educator and a jazz musician. And so after this session, we'll send you an email with the music link where you can hear his hit messages about preventing COVID, but also about COVID vaccine and COVID treatment. And so again, we're looking forward to sharing those with you. Now, as I said, Dr. Leroy Graham is the founder of Not One More Life, a community-based program that has been in existence for well over 20 years and was started outside of Atlanta, Georgia, where Dr. Graham served as a pediatric pulmonologist with the largest group in the country. And Dr. Graham is going to share with us a little bit more about how Not One More Life has really transformed into a focus not solely on asthma, but also inclusive of COPD and COVID. And so I'll turn it over to Dr. Graham and he'll share more about the program.
Well, thank you, Tanya, for that very, very kind introduction. Not One More Life was formed over 20 years ago in memory of a young man that I lost to asthma, a patient that was one of the most difficult patients I had, but one of the most challenging, but yet the most faithful one. And unfortunately, we lost him, as we lose lots of Black people with asthma. But in his memory, we thought that it was so important to educate the community, so that not just educating patients, but educating the community around them about asthma and about lung diseases. And when we did this, a good friend of mine actually suggested it would be very critical to use a trusted messenger in that community. And that trusted messenger was the Black clergy. And just as a historical point, long before integration, the Black clergy were the safe haven. They were the trusted messenger. When people had problems and the public health system or the public assistance wasn't there, they went to the church door and they went to pastors. Reverend Dr. Stinson is a part of that lineage. And these people were the people that gave us entree into the Black community in a position of trust. My being an African American was minimal. It was the fact that I allied myself with the trusted messengers. And I was told by the Black clergy that while they had a primary mission of saving souls, they also were there to provide comfort and to provide a better life for their congregants. And so we marched forward with this unique partnership that has sustained us. As time went on, we found that it was a good place to get with a majority organization like the Allergy Asthma Network of America, led by Tanya Winders, who's an incredible leader. And this has given us both scalability and access to grant funding, such as what is serving as the support of this. So just want to put a shout out to everybody to understand that there are people in the community, like our clergy, who, while not physicians, are valuable and invaluable resources in positions of trust that validate the efforts like Trusted Messenger.
Great. Thank you so much, Dr. Graham. And so as we get started, we're going to talk about some of the latest COVID statistics and the dashboard and a little more details around the program and how we transformed it to really focus on COVID. But first, let's go to a couple of polling questions. Looks like we've got about 600 or 700 people that are active on the line right now. So we want to hear from you. What are some of the most commonly reported lingering health issues from COVID? And then we're going to ask you to check all of them that apply. If I can get this to launch, it's acting a little funny here. Sorry, it looks like Zoom is being a bit challenging tonight. So go ahead and log in. You can check all that apply. Is it fatigue, shortness of breath, anxiety, racing heartbeat, brain fog? Which of those do you think are lingering health issues from COVID-19? I'll give it just a moment, let everybody log in. And we've got just a couple of seconds longer. Go ahead and finish up, and then we'll share the results with everyone. It's great technology that within about a minute, we can get responses from 700 people all across the country and even globally. We've got some attendees from other parts of the world. All right, so let's see here. Dr. Graham, what does this tell us? Looks like that we've got about 75% that say shortness of breath, 58% fatigue, 38% anxiety, and then about a third of people say racing heartbeat and brain fog. What's the truth about this? Are we seeing any one of these or all of them?
The answer is all of the above. So the fact that our audience actually showed some recognition of all of these is very impressive. COVID is a new disease to us, and it is a disease that has an abundance of symptoms. And it's important for people to share this with people that they know, because some people going through this are having symptoms of anxiety, other kinds of symptoms, but clearly this constellation of symptoms warrants getting access to medical care.
Absolutely. So great job, everybody, that you knew that all 5 of these are commonly reported lingering symptoms from COVID-19. All right, so now let's move to our next polling question. Oh, moved a little too fast. And this one is, if you or a family member or friend had COVID-19, were you or they informed by your doctor about the use of monoclonal antibodies as a treatment for COVID-19? So again, we'll launch that poll. If you were informed and received the monoclonal antibody treatment, you can log that in. What about if you were informed, but you decided you didn't want that treatment? Or you were informed, but didn't receive the treatment? No, you weren't informed, or it doesn't apply to you. Perhaps you're one of the lucky ones that has not had COVID yet. We'll look at some of the numbers. Again, we're well over 300 million cases worldwide now. And the numbers have really been staggering. I think all of us know someone who's been through this experience. But let's see how our poll turns out here on awareness about the monoclonal antibodies for treatment. Dr. Graham, I'll go ahead and share those results. And why don't you give us a little bit of background about this?
Well, this is encouraging and still a little bit distressing, because monoclonal antibodies give a very specific therapy. They supplement your own immune response to this disease. And these are life-changing for many patients even before the hospital setting. And it's very important that people know that this is available, because it basically augments or supplements your own immune response by giving specific responses to the COVID virus. So everybody here now knows about this. And if they have a patient, a loved one, or someone in this situation, make sure that they're aware of this.
Great. All right. Well, thank you, Dr. Graham. Let's see. Now let's move on to our next slide, which is the current state of COVID-19. And we're going to ask you to give us a briefing on what's going on around the world, and especially here in the US.
Well, we're looking at this, and one thing that everybody should know is about this Johns Hopkins site. I've been following this from the very earliest part of the COVID pandemic and used it for an editorial I wrote in one of the pediatric pulmonary journals. But it's important to look at where our country stands in relation to the rest of the world. We were a leader for a long time, and we remain a leader. I think this has a lot to do with how we've responded at a public health level. The spread of this has been fairly rampant. I think it's also, and I don't want to get too far into this, but I think we've been hamstrung on certain times by the politicization of this. So it's important that we look beyond these politics and realize that this was a serious infection that has ravaged our country. And it's important to know where we fit in the world community. And just not sour grapes, but we as a country must do better than this. We are seeing now places like India being ravaged and so forth. And really this bespeaks a problem that we need to get more information out about this. So whenever you're asked about COVID and numbers, or you hear things on the news, go to a reputable site like the Johns Hopkins site, and you can Google this up. It is the premier site, not just in the country, but worldwide, to show us the impact of this dread disease.
Sorry about that. It went away. This is.
Well, while we're working with that, again, one of the things that Not One More Life and the network does is we're about empowering people, and knowledge is power. So it's so critical that when you see those of you that are online with us now, what you're seeing is something that you must share with the community and must let people know, and use reputable resources.
So this is going to take just a moment, because the file was actually being shared through Dropbox, and apparently Dropbox has had an issue and a problem. So Dr. Graham, I'm not sure if you have the slides there before you, or want to keep talking, or if you want me.
I'll keep on. One of the things that I think has been very, very important when we talk about this, and we're talking about Black people like me, it is undeniable that we as a race have suffered disproportionately. And it's important to realize this is not just because COVID picked on us. We have a healthcare system in this country, as rich as we are, that is marked by disparities. One of my most favorite quotes from my greatest earthly hero is Martin Luther King, who said that of all the injustices that he'd seen, injustice in healthcare was most shocking and inhumane. So what we try and do, rather than just be angry about that, is to become knowledge points and become people that share information. The Black culture is one where we do share vocally, and it's important to realize. It's also important not to be political, but to challenge our leaders to, in a country of this wealth, we must have health equity. We must have equal access. This country is far too rich for people to suffer and die from diseases like COVID because they have limited access to healthcare.
All right, Dr. Graham, I'm gonna share my screen again. I believe that will remedy our situation. Again, my apologies for the technical issue here. Okay. Everyone should be able now to see the CDC map and statistics.
And again, this narrows it down to the United States. And again, realize again that we're a country of incredible technological resources. but we've not done the best job with this. And I think to be positive and not just kind of rail against the empire, this should be a wake-up call that we need to have proactive health education. We need to have equal access of healthcare. And we as a people, American people, need to share information as we have it. This disease is not about the rich or not about the poor. It has hit every strata of our society. And it is so important that we learn from this and not get caught up in the internecine political battles that rage. Okay.
Great.
So this is Trusted Messengers, and this is a picture of what we did at Ebenezer Baptist Church, where early on it became apparent that those people who were most severely affected by COVID had underlying diseases. And I heard someone I really respect call this a disruptor disease. It got into our own systems and disrupted the normal inflammatory response so that that inflammatory response literally turned against us. And Dr. Gupta might share, and please join in at any point. I may be oversimplifying it, but the reality is that people that had poorly controlled hypertension, poorly controlled heart disease, poorly controlled asthma, diabetes, and so forth and so on, were the people that got very sick with this disease and sadly died disproportionately. So it is so important that we leave here also with the idea that we have to be advocates. We have to get good access to healthcare. And Dr. Gupta, you might want to share something in this context as well.
Yeah, Dr. Graham, I'll just say a couple of things.
Thanks, Dr. Graham.
Oh, sorry, Dr. Gupta, I didn't realize if you saw that we were pivoting there a bit. Okay, so sorry, we are a little off kilter with the technical issues, but I'll go to Dr. Gupta in just a moment. Wanted to share just a little bit about the Trusted Messenger program. So Trusted Messenger, Dr. Graham spoke about earlier, started 20 years ago, partnering with African-American churches, delivering those asthma clinics, asthma educations, asthma screening. And when we saw the issue that COVID-19 and access, the lack of access to testing, the lack of access to vaccine within those disproportionately affected communities, we rallied. And we actually went to Atlanta, partnered with Ebenezer Baptist Church, the very historic Ebenezer Baptist Church where Martin Luther King once pastored, and began to do COVID testing and respiratory screening. We screened over 1,200 patients between the months of September and March. And then we actually provided that COVID testing for all of those individuals within that community. After we screened them and engaged them with their COVID results, then we stratified the population to find those that were living with uncontrolled respiratory conditions. And we offered a free 16-week digital health and telehealth program called Trusted Messengers. And so this program actually helped patients to better identify what their barriers to care were and how they might get better health outcomes, as well as provided remote patient monitoring with tools like spirometry and exhalation breath monitoring. So we had about 70 patients that came into the program, 270 that qualified, but about 73 that signed up and completed the program. And we just got the results and they were remarkable. We saw a greater than 50% of patients that had an increase in lung function. Overall, our patient community had increases in quality of life. They had fewer symptoms in the time that they were in the program, and they used what's called their rescue medication fewer times. And then as expected, there were fewer ER visits and hospitalizations and unscheduled doctor's visits as well. So we're very excited about this program because now we have the opportunity to expand it throughout the nation. And we'll be moving beyond just the Atlanta market to about 8 to 10 additional markets later this year. Dr. Gupta, please feel free to weigh in on the comments that Dr. Graham and I were speaking about.
Tanya and Dr. Graham, thank you for that opportunity. I think effective public health communication, both amongst those that are in the profession and in those that are trusted leaders in the community, has historically, and I'm wondering if Dr. Graham will agree with this. I feel like just being in academia for so long, it's been something that doesn't get enough attention and it's not prioritized necessarily in medical school or as you're coming up the ranks. And yet we found now in the last 18 months that really it's how do you communicate and how do you communicate and to whom that matter more than what the latest scientific evidence says in some obscure journal. So it's really like it's developing effective communication strategies and skills and being trusted in the community that in my view are more important, have never been more important, and have historically not been given the type of prioritization from the medical establishment that I think it will now be moving forward, since we all recognize that public health communication is a vital skill for all of us, not just those in the profession itself, but those that are leaders in our community.
Great. Thank you so much, Dr. Gupta, and fully agree. And that is the very essence of what a trusted messenger and trusted source is. It's those individuals that already have relationship and already have credibility within the community. So Dr. Graham, how about if you continue on here with sharing with us a bit about how COVID-19 continues to disproportionately impact the African-American community?
Well, I think we're seeing the fact that underlying this is limited access. Many African Americans did not have a medical home, were uninsured. So when any patient has symptoms, they should be able to reach out to a trusted physician. And this was lacking for so many people. Also, I think early on, there was a lot of phobia. There was a lot of misunderstanding about COVID. There was a lot of fear. And you know, the Bible and a lot of people teach us that we have to press through fear. And I think that was one of the things that impeded. The other thing I think, and again, not to be political, is that we really did not have the number of medical homes. The term medical home has become very important. You have a home that you live in, but you should have a medical home where in times of need and times of crisis, you can go. And we found that many African Americans do not have medical homes. We know that the Affordable Care Act was a great step in that fashion, but it was gutted for political reasons. So I think, again, this is so very critical when you interact with your political leaders, when you vote, you realize that in a country of our aggregate wealth, it is really an abomination that we have the health disparities that we have. Because quite frankly, in a country of this aggregate wealth and this technology, we should do much better. And we're now cast against the rest of the world, and particularly Western Europe, where they do have national health care plans, and they've suffered distinctly less morbidity and mortality. So minorities kind of being on the lower rung of access have been hit the hardest.
Yeah, absolutely. And this slide shows that perfectly, right? So African Americans definitely have that higher death toll. While they represent 12.4% of the population, they're representing 20.8% of all COVID-19 deaths. So greater than 2 times higher than their white counterparts. So definitely alarming. The statistics, the numbers don't lie. And again, I think that this is why we continue to stay committed and engaged so desperately with the community. So again, this is the framework of the Trusted Messengers project, and with 3 key elements of certainly driving community engagement and patient education, communications, establishing those trusted messengers, just like you see here with Dr. Graham and R&B singer Montel Jordan, who is now a pastor. And then also expanding healthcare access, doing that through screening programs, personalized and patient-focused activities, as well as patient assistance. And then, as we talked about, accelerating that digital engagement. We did this by creating a community health hub and having integrated insights that really generate how can we continue to engage the community and respond to exactly what they need when they need it. So again, I went over some of the pilot projects and the current state of the project when we were having some technical issues. But again, over 1,000 patients reached in disproportionately impacted communities, over 100 patients that had that 16-week enrollment and follow-up care, with 73 patients completing it. And again, we are so excited about how this will advance and continue. It's our aim and goal that over the next 6 months, We will actually screen over 10,000 patients, vaccinate over 10,000 patients, and have well over 1,000 enrolled in that asthma coaching, digital health, telehealth coaching. And if you're interested in participating, certainly contact us at Allergy and Asthma Network, and we will be more than happy to share more details and get you involved in that free digital health telehealth program.
Well, again, this shows that, we're in this for the long haul. Okay, no pun intended. But I think we've established a model that we hope will actually be replicated. We would like people to emulate this and so forth. In our Black community, we know that there is a lot of what we call neighborhood talk. So I hope that everyone here is picking up little nuggets that you're going to share in the barbershop, at the bar, wherever you are, where you come in contact with people. We as a people, as Black people, are used to sharing news. And it's so important that you carry forth what you want about this. I want to make a quick word about Kellen. Kellen is probably the toughest asthma patient I ever had. And Kellen was a trooper. His family was doing a great deal. But Kellen basically wanted to be like everyone else. And the sad thing about Kellen was that on the day that he got sick, okay, he was on a diesel powered school bus, which we know is not the best thing to be on, but that's what the schools had. And Kellen was uncomfortable and showing signs of an asthma attack at school. And no one did anything wrong, but people didn't pick up on the signs that maybe he was having trouble. Everyone did everything they could. He was rushed to Grady Hospital, and he died there in the emergency room. So the whole thing about Not One More Life was that we shouldn't lose one more life. That diseases like asthma are as impacted by education, by knowledge and awareness as they are by medicine. And it is so very critical that we honor the memory of this young man, because it was through that experience, I'm not that smart, it was through that experience and knowing that the church was such a pivotal and influential thing that I went and partnered with them. And in fact, when we started, we had something like 800 pastors in a ballroom in the middle of Atlanta. And I asked all the pastors to stand up. And I said, if any of you have never preached a funeral of someone that has died of asthma, sit down. No one sat down. Okay, I had to get out to 4, 5, 6, 7, 8 deaths. This is something that's ravaged our Black community. Okay, and there are other diseases like this. But while we can get angry about racism and disparities, we have to become aware. We have to be woke, as the young people say. And I want everyone that's hearing this to take the nuggets that you've gotten from Tanya and from Dr. Gupta, who will add more later, and share this with the community, because we are a people that share. We are a vocal people. We learn by word, because it does no good to take that little kernel of knowledge and not share it. And I'm talking way too much, Tanya. Take over.
No, thank you, Dr. Graham. It's so inspirational, and definitely, I know that we've had Kellen's family on before. I'm not sure if they're with us this evening, but what a legacy, and definitely what an impact that even such a young life has made on you and so many others as a result of Not One More Life. So again, please visit us at allergyasthmanetwork.org to learn more about our Trusted Messengers program. You can also go to trustedmessengers.org to learn much more and see our COVID-19 information center and resources there. So next, I am excited to hear directly from a team who has already become such a vocal advocate in this space. And so I'm going to introduce and welcome Sailor McKenzie Williams to the podium. Sailor?
Hi, I'm Sailor, and I'll be talking about why teenagers should get the vaccine. For one, I'm excited to receive the COVID vaccine because I'll be the part of the community that has essentially eradicated this horrible disease. We are very fortunate to have a vaccine. I recognize that there's a mistrust within the Black community due to things from the past, like the Tuskegee experiment. My advice to other teenagers about the COVID vaccine is to not be afraid, for one, because we are the generation for change. We carry intellect and technology and science. And exclusion, if we don't get the vaccine, the future might not be possible.
Thank you, Sailor. That's, again, you're so bright and articulate. And I know that you yourself are moving in that direction of being able to get the vaccine and encourage your peers to do so as well. And so we just appreciate you for speaking up and for being here tonight and sharing your own, views and certainly desire to see more people vaccinated.
You're welcome.
And spoiler alert, that's Kellen's niece. How incredible is that?
That's
Yeah.
awesome. I did not realize that connection, or I had forgotten it. So how cool is that to see that connection between Kellen and his life and legacy and you, Sailor, and you're carrying that work forward. And I know that you're going to make a big difference in the world as a result of it. Thank you.
Love you, Sailor.
Love you too.
Great. Thanks. And Dr. Graham, now we're going to hear from one of our favorite asthma patients and our PCORI patient advocate, Mary White. So Mary, I'll ask you to step to the podium next. Did we lose? There she is. We can see you, Mary. Hold on just one moment, Mary. Sounds like you may be having some bandwidth issues. It's cutting in and out. Guys, we're trying to get her attention to let her know.
Young people.
Mary?
Mary,
sounds like you.
Can you hear us, Mary?
Yeah. Help.
All right. Trying to get her attention in the background to let her know that her internet is having issues. She's pretty frozen here.
Yeah.
How about if we come back to Ms. Mary in just a moment? I'm going to mute her and we'll move on and then come back to her. All right, so next up we have a polling question.
Here, Mary.
Third polling question.
Can you hear me?
Yeah, Mary? Mary? Let's go forward.
Yeah, I think we should. So again, guys, sorry about that. Looks like her internet is having a problem. And that's part of the issue, right? That we don't have even good internet access in all parts of the country, in certain communities. So I'm going to go to our third poll question, and that is, have you received the COVID-19 vaccine? I'll go ahead and launch the poll and ask you all to log in your responses. Yes, not yet, but plan to. Receive the first shot and waiting on the second one. I'm not sure if I'll get the vaccine, or no, I'm not planning to get the vaccine. So go ahead and log in your response and we'll see where we are with our attendees and community this evening. Have you received the COVID vaccine? Now, what I'll share with you for myself is that since we last met last month, I am happy to say that I have gotten both of my shots. And so I am fully vaccinated, as are several members of my family. And I know that Dr. Graham has had the same experience as well. So we'll give it just another few seconds and then we'll share the results of where our community, the online community, sits tonight. All right, let's see what we've got here. So looks like that about 42% of you have actually already received your COVID-19 vaccine. And then 32% say not yet, but you plan to. That's excellent. I'm so excited to hear that. That means that collectively we've got about 74% or 3/4 of the population here that plan to be vaccinated. And then we've got 14% that have had at least one shot and 11% that are still a little bit on the fence. And that's okay. That's why we're here. That's why we're talking about this evening. And we certainly realize that this is a very personal decision, that you need to get all of the information and feel like you're making the most informed decision that's best for you and your family. And then 2% that say they're not planning to get vaccinated. But again, a very activated, engaged, and educated community here online this evening. So with that, Miss Mary, let's try to see if we can get you back here. Miss Mary? Maybe, maybe not. Okay, well, then we will just keep moving forward in our presentation. And I am certainly very excited about the next speaker, two speakers actually. They're going to tag team. Dr. Gupta, as I said, is a pulmonologist and public health physician, professor, and health policy expert with Combat COVID. And then the program director, Ms. Lola Williams, who is a master's in business administration from the U.S. Army Medical Material Development Activity and part of that federal COVID-19 response team for Combat COVID. So I'm going to invite Ms. Williams and Dr. Gupta to share with us now.
Oh, so good evening, everyone. It is a pleasure to join you all today. As Ms. Winders mentioned, my name is Lola Williams, and I'm actually working with the federal COVID response on therapeutics. I started off working with COVID-19 convalescent plasma, and right now are really working on expanding access of monoclonal antibodies across the country in underserved and underrepresented communities. So I'm here today to share important information with you about asthma and COVID-19 in the Black community. Next slide. Oh, keep going. Okay. First, let's look at the big picture. In the past year, we've made incredible strides against COVID-19. We have discovered life-saving vaccines and treatments that are helping us turn the corner in the pandemic, but we still have a lot of work to do. The administration is deeply concerned about the disproportionate impact of COVID-19 on communities of color. An example is from a recent study of deaths from COVID-19 in US cities and states. It found that 34% of COVID-19 deaths were among Black people, yet Black people only account for 12% of the total populations of the United States. Another study found that counties with higher percentages of Black residents had higher rates of COVID-19 cases and deaths than counties with higher percentages of white residents. Facts like those are why we're working hard to keep people informed about the latest research and treatments for COVID-19 that can actively reduce suffering and save lives. Next slide. Now, what do we know about COVID-19 how COVID-19 affects asthma patients? There is some good news. The latest research shows that asthma patients are no more likely than people without asthma to be hospitalized because of COVID-19. Also, asthma patients are not any more likely to be infected with the coronavirus than other people are. Still, it is so important to protect yourself because if you do get COVID-19 as an asthma patient, your symptoms could be more serious than for people who don't have asthma. Next slide. Some people with asthma do face extra risks from COVID-19. For example, scientists have compared the effects of the disease on people who have asthma because of allergies and its effect on people who have non-allergic asthma, the less common type that is not triggered by pollen or dust. Research found that people with non-allergic asthma have a much higher risk of serious symptoms if they get COVID-19 compared to people with allergic asthma. Also, Black people are not only more likely to suffer from asthma than other people, they are also likely to have serious COVID-19 symptoms. This is the one reason, oh, sorry, actually you can go to the next one, yes. Next slide, sorry. This is one reason why it's so important for communities of color to have the latest information on COVID-19 and to have the opportunity to participate in discovering treatments. The U.S. Department of Health and Human Services has created a website where you can find current accurate information about vaccines, treatment, and research about the disease. And the website is called Combat COVID, and you can find it at combatcovid.hhs.gov. And here there's information for patients. There are information here for providers and doctors, and has lots of great information on treatment options, and especially for those who have underlying health conditions like asthma. Their monoclonal antibodies is really a great treatment if administered early, that could really reduce hospitalization and save your life. Next slide. Oh, back one. Yes. So talking about the active research studies and clinical trials. Since the beginning of the pandemic, scientists have been working to find COVID-19 treatments that are safe and effective for everyone. Thousands of people have already taken part in the clinical trials for COVID-19 vaccines and treatments. And because of that, we have 3 vaccines and treatment using monoclonal antibodies. Next slide. But there's still so much more work to do, and we need more people to take part. Please educate yourself, share the facts about the vaccines, the treatment, and research on COVID-19. Visit the website that I've mentioned before, follow us on social media, and tell your family and friends about the website. And please encourage your family, if they do feel as though they have symptoms, go get tested early. And as I'd mentioned before, monoclonal antibodies do really reduce the hospitalizations and death if you end up being positive. And if you're not positive, please get vaccinated. I know Dr. Gupta will talk a little bit more about vaccine and vaccine hesitancy. And as we've all heard too, now we have preteens that are now eligible to get the Pfizer vaccine. So I'll be taking my 15-year-old daughter to get vaccinated. Myself and my husband are vaccinated, and he's a frontline worker. And please just educate yourself, and let's try to stop the spread of this deadly disease. So now I'll turn things over to Dr. Vin Gupta, who's going to share some facts about vaccines.
Thanks, Lola. And it's great to be here. I will try to keep my comments to about 10 minutes, and then happy to answer questions. There's just so much that we could talk about in our time together, and I'd like to focus it on strategies that I've tried to utilize in whatever platforms I've had to talk about the vaccine, and really trying to get at maybe some of the reasons why people are concerned about the vaccine. And I think number one, there's confusion about why you should get the vaccine, and in part, I think we public health officials are leaders across the federal government that are in charge with messaging on it. I think, when we look back at this time, we're going to say, well, we could have done certain things better. And one of them has just been on how do we communicate to people why you should get the vaccine? And I'm not trying to call out the New York Times, but this particularly was troubling to me, where the New York Times and other media outlets, not just the Times, had this headline a few weeks ago about AstraZeneca saying that it was 79% effective against COVID. And that was just the wrong headline, because effectiveness means, does the vaccine keep you out of the hospital, and does it save your life? Efficacy references this type of really complicated, very difficult to read slide that we focus on in academia and at the Institute for Health Metrics and Evaluation at the University of Washington, where the institute that I'm a part of. This is the data that we are looking at internally about, well, does Sputnik in Russia, or does AstraZeneca in the UK, or Pfizer, Moderna here in the US, do these vaccines protect against your ability to unwittingly transmit the virus to somebody who might not be vaccinated? So that asymptomatic transmission possibility that we've talked a bit about. Or what do they do when it comes to keeping you out of the hospital and preventing severe pneumonia? It's two different questions. And yet at the end of the day, shouldn't we be messaging to people that, well, AstraZeneca, for example, actually to the tune of 100% kept everybody in its clinical trial out of the hospital that received the actual vaccine. And so, yes, it's maybe not as effective at reducing sniffles and mild infection from COVID, but gosh, it is darn good at making sure that if you get it, you're kept out of the hospital. Same thing with Johnson & Johnson, same thing with Moderna, same thing with Pfizer. If you get the vaccine to the tune of nearly 100%, you're kept out of the hospital. That's real world effectiveness. And yet we missed the boat on messaging, in my view, to clearly convey that point to the American people, and I think, frankly, to the world, that the purpose of the vaccine, I shared this on social media a bit, is to keep your lungs from looking like the lungs on the right. That's a set of lungs from actually an individual that was in their early 30s that I cared for down in Arizona not too long ago. That's an individual that has severe acute respiratory distress syndrome from COVID-19 and actually had asthma on their prior medical history as a pre-existing condition. And they were not vaccinated at the time. Vaccines were not readily available at that time. And they came down with severe pneumonia, ended up dying on a ventilator. This is exactly, whether you have asthma or don't have asthma, whether you're young or whether you're old, this is exactly what the vaccines prevent. They prevent your lungs from looking like the lungs on the right. And they keep your lungs looking like healthy lungs on the left. And yet we've missed the boat on this messaging. And we get too caught up in these crazy percentages talking about asymptomatic infection versus, I think my AirPods just died here. We focus so much on asymptomatic infection and not the things that matter. And that's caused a lot of confusion from what I've seen. I did want to talk a bit about monoclonal antibodies in this case, and then bring it back to asthma. Whenever I've had a platform to speak on the news or what have you, it's been to try to address information asymmetries that exist in the public. Frankly, most people back in January just did not know about monoclonal antibodies. And it's unfair to some degree. I wonder if Lola will agree that we expect people to listen to folks on the news or to go to a website to understand if they meet a certain set of criteria. In the case of monoclonals, that you're older, 65 and older, or have a pre-existing condition, and I've had mild to moderate symptoms with COVID for, say, within the last 10 days, then go to this website and you can potentially get access. As Lola and I and others at Combat COVID have discussed, this is a different paradigm to access advanced healthcare. It's putting the onus on the patient and not on the provider to say, hey, you might qualify for this. Let me make sure that you can get access to it easily. No, what in fact has happened is I've probably gotten approached hundreds of times, as I know Lola and colleagues have at HHS, about, well, how do you actually get this darn medication that we know can be life-saving in an easy and effective way? We put the onus on people, not on the provider. And that has caused a lot of confusion. Frankly, our health system's not nimble enough to be able to do that. It can't just, it's hard for patients to know what they need, when they need it, and how to get it. And essentially with some help from Combat COVID, that's the paradigm here. So that's been the challenge, to get this treatment to people. We expect them to follow guidance that they might hear through some sort of media outlet or channel or on Combat COVID's website, and then to act on it. And that's assuming a lot. As a lung doc that's try to see if people would avoid smoking and vaping, expecting your patients to go above and beyond the normal expectations for a patient population and seek out advanced therapy, that's asking a lot. And so that's one of the big challenges here. I did want to flip to something else, talking specifically about asthma and COVID-19. I've heard a lot as a pulmonologist. Well, you know what? Actually, as an asthmatic, you're not at increased risk for developing infection with the virus, and maybe you're actually protected from the virus. And I think there's been a lot of hypotheses out there that, well, is it maybe because you're on chronic steroids, inhaled steroids? Does that protect people that are asthmatic? And is that why we're seeing less rates of asthma amongst those that are COVID positive? Or is it because
there's a lot of mucus that gets built up in the airways that actually will make it difficult for COVID to actually enter our lung cells, because there's tends to be mucus and inflammation in asthma, in lungs that are afflicted by asthma? Or is it because COVID needs a specific enzyme to enter our lung cells that we think is lacking in people that have asthma? The answer is we don't know. And I've actually been worried about putting this type of information, this hypothesis, I'm sharing this amongst the larger asthma and allergy community, because I personally have found this to be quite confusing to my patients who are asthmatics, who come to me and say, well, hey, doc, does that mean I can not wear a mask? Or does that mean that I don't need the vaccine? The answer to that is you should, well, CDC guidance today notwithstanding, if you've not been vaccinated, you should still mask, but you definitely need the vaccine. And I worry about these hypotheses that are half-baked, that have not been proven, but that are out there and that have gained some traction, leading people who have underlying asthma, which is a serious condition, as all of you know, to think that maybe they might be immune or invincible from this virus or don't need the vaccine. On the contrary, they absolutely do. And so I wanted to share that because that's been something that I've been struggling with, is how do you message, how do you counteract? In this case, it's not misinformation, but it's hypotheses. We haven't proven this to be the case. And yet there's these advanced scientific hypotheses out there that seem credible, but that have yet to be proven. And they could have serious consequences in changing how people think who have yet to receive the vaccine, who are asthmatic, on whether they should or should not get it. I'm here today to say that all those hypotheses are just that. They're unproven theories. So if you or someone you know is suffering from asthma, they absolutely need the vaccine. They are not invincible. And there's so much more we don't know about how COVID affects people than what we know about how it infects people, especially those with other underlying conditions. So there's a lot there, but just to emphasize to Lola, number one, what Lola said, monoclonal antibodies, in my view, and I know that Combat COVID, of course, strongly shares this perspective, have been underutilized across the United States and across the world, in part because of an information asymmetry, because people just don't know about it. And it's a darn shame that they don't know about it. We've tried to rectify that. Lola's done incredible work trying to amplify that work, as have others. But we need to think forward about what happens in the future here. How do we get people information in a readily accessible, easy to understand way that then will allow them to actually get access to this therapy in a timely fashion? Sometimes I'd go on a news outlet, say, please go to combatcovid.hhs.gov, and they'd say, well, hey, doc, we did exactly what you told us to do, and we still couldn't get the medication. There are a lot of still barriers here to smoothen out. We're making progress, but this has shown us that there's things that we can optimize. But I'll leave it at that, since I know we're coming up at time.
Yeah,
And Dr. Gupta, and I just want to say one thing, Dr. Gupta. We wholeheartedly agree, and that's why the federal government has partnered with industry in order to expand monoclonal antibody infusion access across the country, and not just expanding access, but really working on that patient referral provider, so that once a patient gets tested and they have underlying health conditions like asthma or other comorbidities, they don't get lost in the process, and they're able to be referred to the closest infusion center where they can get that treatment. Although it says up to 10 days, really it's within the first 5 days. If you can get that is going to reduce, most likely you won't have to be hospitalized, and it will increase survival. So Dr. Gupta, you hit the nail on the head, and it's more than just advocating for the patient awareness, but it's provider awareness, and also really assisting in the health system and health inequities, and really closing that gap. So.
Yeah, thank you, Lola and Dr. Gupta. We actually started a dialogue and a conversation with this group about monoclonal antibodies back in early March, late February, early March, for the first time, making them aware. So we have a couple of questions that are directed to you both. And so I would ask that if we could go ahead and engage you all on these few questions. So the first question says, are monoclonal antibodies a typical treatment for quote unquote mild COVID? And so how do I know if I actually qualify for one of those treatments?
Thank you for that question. It's so difficult, right? We put out there in the public domain, if you have mild to moderate symptoms and you're 65 and older, or if you're 12 and older and have one of a set of underlying conditions or are immunocompromised, and these symptoms have started within the last 10 days, please go to this website. It's a word jarble. It's complicated. I sometimes have to look at the criteria myself. Mild to moderate, what does that mean? Well, that means you're short of breath, or you're coughing, or you have a low-grade fever less than 101.3, but the shortness of breath is so limiting that you can't even walk on flat surfaces, or that isn't causing chest pain, or isn't causing you to pass out. That the cough isn't so unremitting that you can barely have any moments of not being able to cough. That if you have an oxygen, I feel like I've shown this so many times in so many public domains. I just need to buy everybody one. Not that I could afford that, but this pulse oximeter, this oxygen monitor here. I'm sure some of you are familiar with this guy, and you might actually have it, but mine is showing. That can't be right. Oh, 95. Okay, it was initially not showing a good number, but this can be helpful, and there's no rule of thumb here about what's normal. Everybody has a different normal when it comes to the oxygen level, but I would say if you already know your baseline, whatever that baseline is, if it's 4 points lower than your normal baseline, that would concern me in the setting of consistent symptoms, shortness of breath that's not going away, or it's getting worse, a high fever that's getting worse. That's when you want to say, okay, I should go and seek medical attention. But if you're not meeting any of those metrics, if say like you're normally 96% on your oxygen monitor and you're 94, and you're feeling otherwise okay, you can move around your house okay, your fever's less than 101.3, and if nothing's escalating or getting worse, that's where I would say you fall into the mild to moderate category. There's shades of gray here, but especially if you have those symptoms in the setting of positive COVID diagnosis within the last 10 days. So, within that 10-day window, go to the website, combatcovid.hhs.gov, look closer at the eligibility criteria. And then there's actually a geolocator where you can find, based on your zip code, numbers to call. And Lola and team have done a great job updating that to make sure that those numbers lead to something useful on the other end. I'll tell you, and Lola, I've been honest with Lola, when we tried to iterate on this back in January, we would call and then you'd get an operator who would just like, what are you talking about? And then hang up the phone. But now it's improved dramatically so that it actually goes to somebody that will do something for you that's useful. So just credit to Lola and team, but that's how I think about mild to moderate. And it is true. The data suggests that if you get this early enough, especially if you're high risk, that it's going to stop progression of the disease and keep you out of the hospital.
Absolutely. Yes, Lola?
So Dr. Gupta and maybe even Dr. Graham to add to that, because we've had this question that come up a lot as well. What about those who are asymptomatic, right? So they've tested, it's come back that they're positive. They may not have, symptoms yet. What for those people? Because what if they progress and maybe rapidly decline? So would you still advise them to go get in front of a physician or a PCP?
My advice, and Dr. Graham, by all means, please, I love your thoughts on this. I think if somebody is asymptomatic to moderate symptoms as described, and they meet a high risk criteria as defined on the website. I see people wondering just about the website. Again, it's Combat COVID, and I'll put it into the chat, combatcovid.hhs.gov. I think asymptomatic high risk individuals should get should still at least be considered for the infusion, all the way up to moderate. Once you get to the point that your oxygen levels are low and you need hospitalization, that's when we think the monoclonals are less useful. But certainly asymptomatic to moderate, if you're otherwise high risk, I'd love to give it to you. I certainly would want that therapy for my high risk loved ones in my own life. So I'd want that for my patient.
have nothing to add. I would agree totally with Dr. Gupta. And this disease is a rapidly progressive thing in some people and quite variable in others. It's always right to beg the question if you have a concern.
Great.
And I know I'm not the doctor, but I would say also, if you visit the website and you're like, I don't know what this means, what's comorbidity or whatever, better safe than sorry, go to a primary care provider. And we also understand, right, especially in the Black community, Black and Brown communities, they don't have, that access, right? And so that's one of the things that we're also trying to work on is how do we get people who typically don't have access to healthcare in front of a PCP so that they can, be screened to either receive the monoclonal antibodies, or if it is serious, for them to be hospitalized, and really get away from the you have mild to moderate symptoms, we'll send you home, but really trying to give some more care to those who typically don't have that access.
Absolutely. Absolutely. And that is, again, our shared priority, and the reason why we've been doing the Black People Like Me video conference series and have engaged well over 2,000 or 3,000 people over the last few months in this conversation, and why we continue to do the Not One More Life Trusted Messenger program. And so, again, I want to thank Dr. Gupta and Lola for sharing, and certainly all of the great work that HHS is doing through the Combat COVID website. We will make that resource available in the follow-up email as well. And now I am very pleased and just honored to invite Reverend Dr. Michael Stinson, who is one of our clergy advisors to this program, to the Black People Like Me program. When he started on this journey with us 6 months ago, came in as an asthma patient. And now he is here speaking to us as someone who has not only been deemed as an asthma patient, but also has survived his own battle of COVID-19. And so we've asked him to share his story, his journey. Dr. Stinson?
Thank you, Tanya. And good evening, everyone. I was introduced as Reverend Doctor. I want to make sure that you understand I do not have a PhD in philosophy or theology or a doctor of theology. My doctorate is in medicine. I am a medical doctor, practiced medicine for 16 years before I found myself where I am today in religion as a pastor. In that role, I actually met Dr. Leroy Graham about 35 years ago, if you can believe it's been that long. So I was very honored when Dr. Graham started Not One More Life and asked me to come on board, not only as a part of his board, but as his board chair. And I lovely shared that responsibility for more than 10 years. And one of the things we found out with Not One More Life is that we tested more than 6,000 people in the Atlanta metropolitan area. And we found that it was a significant number of people who said we have no problems with asthma, no problems with air breathing or with anything affecting our lungs. But a significant number of those people did have abnormal lung function tests. And because of that, some had asthma or some other type of reactive airway disease. So we would send that information to their primary care physician so they could get further treatment. And if you have asthma but don't know that you have it, you can still die from it. And that's why it was so important for the work that we did, working with the community, with medicine, but also with the faith-based community to get the word out. Now, I have what's called adult onset asthma, which means I didn't get it when I was a kid. I actually was an adult practicing medicine, and we adopted a cat, my wife and I, and the cat was around me a lot one day, and I noticed I had some itching on my arm, and then I had difficulty catching my breath. And I began to wonder, it's like, this seems like what people talk about when they have asthma. And I went into the emergency room and I was diagnosed with asthma. Now, my asthma was very, very mild. I would have used my recovery inhaler, my rescue inhaler, maybe 2 or 3 times a year. And when I would use it, I might use it 1 or 2 times in a day and then not use it again for several months. So I never thought that I would be at high risk for COVID, or excuse me, for the consequences of COVID because of my asthma status. but that's what happened to me. My father died February the 3rd of this year. And because of that, I was around family members. And because being around family members, I ended up catching COVID. Now, my symptoms were very mild at first. I had no symptoms for about a day after the exposure. Then I had a slight fever. And then I noticed I was using my inhaler much too much. I used my inhaler about 5 times one day, about 8 times the next day. And I began to wonder, could I be infected? So I went into the hospital I went into the urgent care on February 11th and got my test, and it came back that I was positive for COVID. I'm glad we're talking about the antibodies because being a physician or an ex-physician, retired physician, I knew about the antibodies. And I talked to some other of my physician friends, and they were all very interested and told me very strongly that I should go and get the antibodies. So I called up my primary care physician on the 11th and said, on the 12th, and says, hey, I need to get the antibodies. Can you help me get the antibodies? And he told me he was going to get back to me. Now, that was on a Friday. So on that Monday, my mother, who is currently 89, was then 88, came down with a positive COVID test as well. Contacted her physician on that Monday. On Tuesday, she had an appointment for Wednesday to get the antibodies. My physician still had not called me back on Tuesday. So I called him again on Tuesday and said, hey, I need to get these antibodies. Did not hear from him at all on Tuesday. On Wednesday, I called, and I was not so nice with my response to them. And so I got a call back Wednesday evening from his medical assistant, and I actually got the antibodies on that Thursday. Now, my exposure was on Monday. I got a positive test on Thursday, contacted his office on Friday, and did not get the antibodies until Thursday. As you just heard, Lola Williams says, if you can get the antibodies fast enough, it will help you. Well, it was 11 days after my exposure that I got the antibodies, and it did not help me. But I am very grateful that it did help my mother, because all she had for symptoms was about 2 days of lethargy, and then she got back to her normal self. And right now is totally asymptomatic. Me, on the other hand, I got the antibodies on the 18th. On the 20th, which was a Saturday, I was having problems catching my breath, and I was trying to figure out what was going on. And I had a pulse oximeter that Dr. Gupta was talking about, and my reading was 76. And I saw that, and I started taking some deep breaths, trying to get my level up, and I could not get it above 84%. That's not good. So I tried to call my doctor friends to tell me something I could do besides going into the hospital, until finally they said, you need to call one of my friends who is an ER doctor, Dr. Arthur Griffiths. And I called him, and he would not even listen to me tell the story. He just kept saying, Mike, go to the doctor, go to the ER, go to the ER. So I finally went to the ER. When they came in and they took my pulse oximeter, the doctor didn't say anything, but he's staying. They took a chest x-ray, they started medicine, they started treating me, and they gave me remdesivir, which is the antiviral drug that is used most often for COVID at this point. And they gave me the 6 doses starting on that Saturday. And on Wednesday, they were supposed to be discharging me to home, but I spiked a small fever, 100.4. They did a repeat chest x-ray, and my chest x-ray actually looked worse on Wednesday than it did on Saturday after the first diagnosis. So I said, we need to have a pulmonologist called in. And they told me, well, we're going to have you sent home with a consult to pulmonology. And this is what was good about knowing medicine and being a physician. I know that you need to get a consult while you're in the hospital. So I told them, no, I need to see a pulmonologist now. And I'm so glad that I did, because I believe that he saved my life. When he came in talking to me, he was talking about all the latest studies. He was talking about studies across the world. So I knew that he was well-read and knew what he was talking about. And he told me that when he saw my chest x-ray, it looked so bad, he wondered why I was not intubated. You saw the slides that Dr. Gupta put up. Well, my x-rays looked a whole lot like the ones on the right side with the bilateral pneumonia that was very, very bad. He wondered why I was not intubated, and I can only thank God for that. I'm a runner and I'm part of a running group, and I usually run about 10 miles a week. But in January, we had increased our running for competition, and I was running 40 miles a week. But even being a healthy individual, running 40 miles a week, because I had that underlying asthma, my disease, this disease, COVID, hit me so bad that it almost took me out. I spent 10 days in the hospital. One of the things the pulmonologist did was start me on a new drug called ivermectin. It's not a new drug, but it's new in use for COVID. It is a anti-helmintic, which means it goes against help you fight against worms if you get worms, but it shows good effects against people who actually have COVID. So he started that medicine, and I ended up getting out of the hospital just about a week later on March 1st. Now, remember, I'm a healthy individual, a runner, and 40 miles a week, but still got this disease. I got out of the hospital on March 1st and was on oxygen until April 13th, almost 2 months on oxygen as a healthy individual. I'm just blessed that I was able to go through this and still come out on the other side. But even out on the other side, I'm still not out of the woods. This past weekend, I went walking for 5 miles. I'm not back to running yet because I'm not there. I'm still tired. I still have a little shortness of breath, but not nearly as much. But I do have brain fog that's really, really bad. So bad that I had to tell my congregation that if I'm tell you I'm going to call you and I don't, please call me and count it against this disease and not against my heart towards you. I also have that's a part of what's called long hauler syndrome. People who have this continued symptoms from this disease after you actually have gotten through the disease and no longer are positive. Another one of the things that I have is a serious rash, which is a issue. And I'm not going to tell you where it is. I'm just going to say it hurts when I sit down sometimes. Now, as far as the vaccine is concerned, I have not gotten the vaccine because I did get the antibodies, and I can't get the vaccine for 90 days after the antibodies. So that would be May 18th. And I'm looking so forward to getting the vaccine myself and my mother to make sure that we don't have to worry about this disease again. Because as we talked about, not one more life needs to be lost to asthma, and also not one more life needs to be lost to COVID. Thank you.
Absolutely. Thank you so much, Dr. Stinson. Number one, you are blessed, and we are so grateful that you are healed and certainly here with us and sharing your experience. It's so powerful. And thank you for the encouragement on, just knowing your journey through COVID-19, through long haul. And we know you still have a ways to go, but it's so wonderful to see you, and we are so very thankful for you sharing your experience this evening.
Just thanking God I'm not where I was 3 weeks ago or 2 weeks ago. Much
Amen.
better every day, and giving him the praise.
Absolutely. Well, thank you again. All right. So we do have just a few more minutes as we are going to wrap up. I know that we're beyond time. If you want to stay, we are going to pose a few questions to our panelists that have come in. But I think we may have Mary White with us. So I wanted to ask the first question to Mary, and that is, how can patients and people like you get involved in PCORI research and stay involved even after our Black People Like Me virtual conference series is over? Mary? I was told we have her. Let's see. All right, maybe we don't. Let's go to the next question while we still have some time here. Okay, let's see. How about this question in regard to, if you get vaccinated, can you still get COVID? And can you still spread the virus, the COVID-19 virus? So I don't know, Dr. Graham or Lola or Dr. Gupta, would you like to address that? Dr. Graham?
I can't get on yet.
Actually, you're on. So
Okay, sorry.
we
yeah.
can see and hear you.
My limited experience is that it is very, very unlikely, you can hear me, I hope, that
Yes.
you are able to get it. I am also told that people that have had it should probably be considered a discussion with their physician about getting it. So I can see very little reason not to be proactive at this stage to go ahead and get a vaccine. Hope that helps.
Yes, yes. So you can potentially still get the virus, but a much lesser case is what we've heard. Very few instances where people still get it. And again, can you be a carrier? The data is not all that conclusive at this point. We don't know that for a fact, but it's a great question that we need to continue to gather information. Now, this is a question that's come up very common and very frequently, and that is the concern around infertility and the vaccine. So is it true that if a young woman of childbearing age gets the vaccine, that it could render her infertile?
Again, I have heard that come up, but I have not seen any objective evidence of this vaccine, like all other vaccines, has not been associated with problems with infertility. But in all cases, a woman should talk to her physician about this. But from the data that I have read, there does not appear to be a contraindication.
Yes, that's exactly what we have understood as well. We've had conversations with the experts in the OBGYN field, and they have confirmed that they are advising their patients to get the vaccine. So again, there is no reason at this point to avoid the vaccine if you are in those childbearing years. But again, something to discuss with your own individual physician and make your own decision around. All right, let's see. I have a few other questions coming in. Let's see. Do we have Mary back at this time? No?
Hello?
Yeah, she's there.
Oh, hi,
Hi, Mary.
I can hear you.
Yes. We can see you. Go ahead and talk.
Okay. I'm here. I'm here, everybody. Sorry. Sometimes
I think there's a bandwidth problem.
Yeah, Mary, I'm sorry. We're still having a lot of audio problems.
Can you hear me?
Yes. Try again.
Yeah,
She's muted.
sorry. I think her internet is just simply not cooperating this evening. So sorry about that, Mary. Again, I know Mary wanted to share with you guys about how to stay involved in patient-centered outcomes research. And so what I would suggest is that at Allergy and Asthma Network, we do have a new research newsletter that's going out every 2 weeks that we can help you to understand what are the opportunities to get involved and stay involved in different research projects. It may be listening sessions and sessions like this where we're communicating back and forth with the public. It may be surveys or focus groups or advisory boards. There are many different ways to get involved in research. And so certainly, again, we will continue to share those with you. Now, I want to bring your attention to just a few final things as we close out this evening. And that is, as of this week, President Biden announced additional efforts to get America vaccinated. The goal is 70% of the US adult population to have at least one vaccine shot by July 4th. And we know that this will help us to get back to whatever that normal or new normal may be. So the government is going to offer free rides to anyone who wants to get vaccinated. There's a program through Uber to do that, as well as free ride offers throughout different communities. Community colleges nationwide are going to be hosting vaccine sites. And then there's going to be these additional support for grassroots community-based efforts to get people vaccinated, tested and treated. And Lola was telling us about one particular effort in the greater DC, Maryland area to get people access to the monoclonal antibodies once tested positive. So that, alongside with the efforts that we talked about with Not One More Life, of going from city to city and doing COVID testing and COVID vaccination, there are so many different ways to access this important element within your own community. Dr. Graham, I see you.
Yeah. The one thing that I want to say is that you all have heard from the very beginning of this pandemic, this 70 to 75%. That's people that have either been infected or have gotten vaccinated. And basically that gives what we call herd immunity. This means that the virus literally doesn't have enough people to sustain its transmission. And this has been shown in many, many viral diseases throughout history since we've had vaccination. So the actual getting vaccine is not just protecting yourself, but becoming part of a population that has either seen this virus and developed immunity or gets immunity by vaccination. So this again is a community thing where we're all helping each other. And that 70% that President Biden has cited would get us there, far above that when we consider those that have also had the actual infection.
Yeah, absolutely. And this is about protecting yourself, your family, and even your broader community. And so again, we are so grateful that you all have given of your time and engagement here this evening to talk about this, to continue the dialogue and the conversation. And we encourage you to stay involved as we continue to move through this journey and pandemic together. So as we come to the close of this evening, I just want to thank you all. I want to thank our leadership team at Allergy and Asthma Network, our Director of Research, Mary Hart, and our Chief Digital Officer, Chief Operations Officer, Linda Mitchell, who have been really instrumental in pulling this full program together over the last 6 months. I can't say enough of thanks to Dr. Leroy Graham as our medical director, and really the individual whose heart and passion for the African American community is what sparked this effort and this project so many months ago. And without his leadership, it would not have been as successful as it has been. Again, there are so many ways to get involved and stay involved. So we have an Asthma 360 registry, a COVID registry, our Black People Like Me Facebook page. We have a wealth of education materials, webinars. Always go to allergyasthmanetwork.org, sign up for our newsletters, get that research newsletter, find out how you can volunteer with the network or with PCORI, participate in research, advocate on behalf of yourself, advocate on behalf of your family, and most importantly, advocate on behalf of your community at large. This is our right and our responsibility to move health forward for the community as a whole. And so again, I just want to thank each of you for your time and attention this evening, and know that we will follow up with all of you with an email as well as with the gift cards, and there will be an evaluation. And if you complete that evaluation, you'll be added into an additional drawing. So please send in your evaluation. Let us know how we can continue to support you, what we can do better. We know there were some technical issues tonight, but I really appreciate all of you sticking with us and continuing to breathe better together. So thank you and have a wonderful evening.